afternoon, everyone. Thank you for joining us today. I have the pleasure to introduce our guest speaker, Sarah Roberts. She'll be speaking about the intervention to educate and improve underrepresented populations' participation in clinical trials. The CU Cancer Center's Office of Community Outreach and Engagement has been working on increasing clinical trial diversity and overall awareness and education of clinical trials. Sarah Roberts, who has her master's in kinesiology, is an outreach and engagement coordinator for the Cancer Center and provides community health education related to clinical trials, as well as project coordination for the Office of Community Outreach and Engagement. Thank you for speaking with us today, Sarah.
Thank you, Tiffany. Sorry for the lengthy project title. That's how those things go sometimes. Let me share my screen now. Okay, so you all should be able to see my slides. Feel free to stop me if you cannot. But yes, as Tiffany said, I work with the Office of Community Outreach and Engagement here at the Cancer Center. It is a fairly new office within the Cancer Center. We have been now, quote unquote, on campus for about a year and a half now, around a year and a half. I've been with the Cancer Center itself for the last 2 years, and prior to that, I was with the College of Nursing. So, of course, I'm happy to say I've been with the university for the last 5 years-ish. And yeah, the purpose of my talk is to tell you about one of our projects that we have going on in the Office of Community Outreach and Engagement, which is that really long title that you see on the screen and that Tiffany went through. Essentially, it's just to inform you all about the Cancer Center and the community outreach and engagement efforts to increase clinical trial diversity. So I'll start with just a brief overview of our office. This is the team of the Community Outreach and Engagement Office. We are directed by Dr. Barayo. Daniel Pacheco just joined us in April as our program manager. We actually haven't met, we've met with him in person, of course, but we haven't worked with him in person since he started when we were all already working from home, but he's been the newest addition to our team. Jose Barone and I are both outreach and engagement coordinators. Carlo Caballero is our patient navigator. He's also a licensed professional counselor and certified case manager. Ellen and Amy are also a part of our team, and we are hoping in the future to hire a cultural and linguistic competency coordinator that would be a full-time position. And I think that's something that we're hoping to pursue once this pandemic kind of settles down a little bit. So that's definitely a brief overview of our office, at least who the team members are. As an NCI designated cancer center, NCI has pushed forward a national effort to expand the offices of community outreach and engagement within all NCI designated cancer centers. And I will say leadership on our campus especially has been tremendous in helping us carry forward these efforts on our campus. We have a community advisory council that's made up of different stakeholders that represent most areas of the state. And the Cancer Center leadership has been super engaged with all of those meetings and in discussing various topics with those council members. And that's been really awesome to see that from their leadership. So our aims for the COE within the Cancer Center are to better understand the cancer burden, the data on cancer burden, what the risks are, different disparities in our catchment, which I think probably all of you know this, but in case you don't, our catchment area for the Cancer Center is the entire state of Colorado. And that's actually different for a lot of the other NCI designated cancer centers. Most of them just have sort of a region of the state to focus on. So we are focusing on the entire state, and the goal is to try to better understand how we can enhance and disseminate the research that's going on our campus into the community. I think that's definitely something research as a whole could improve on, and that's something that our COE team is trying to be leaders in, I guess, in terms of the cancer centers with just disseminating that research. And then, of course, we want to engage communities in science, education, advocacy, so that we can reduce all of these cancer-related issues. So that's a bit about our office's efforts with the Cancer Center and what we hope to achieve. And now this is more about the National Outreach Network, which the project that I'll talk to you about today is a part of. So the Cancer Center is part of the NCI's National Outreach Network, which is basically divided up into these different regions that you see. That's what all those different colors are. And then the purple sort of flags are where the participating sites are, which are 24 that participate in the National Outreach Network's Community Health Education Initiative. So we are one of 24 that are doing that. The goal of the Cancer Center, the goal of the network is to enhance the NCI's cancer health disparities research through culturally tailored education and outreach, so that we can improve our ability as educators and as people who are interacting with community members to disseminate culturally appropriate, evidence-based cancer information, whether that be treatment or prevention and screening efforts, or in this case, how to engage in a clinical trial. And then, of course, the network also would like to adapt efforts along the way. So a while back, the National Outreach Network put forward a funding announcement for 3 different initiatives. We are engaged here at our Cancer Center in 2 of them. One is the HPV vaccinations effort to increase HPV vaccinations within our state. The other one that our site is not specifically engaged in is Screen to Save, which is a colorectal cancer screening effort. As I'm sure you all know, we have an awesome cancer screening program within our Cancer Center too. The clinical trials effort is the one I'll talk to you about today. And that's obviously to increase clinical trial enrollment diversity. So our primary objectives are to educate and inform underrepresented cancer patients and caregivers, and really anybody who's interested in learning about a clinical trial, to increase awareness and understanding. I think there's definitely, it's definitely timely with COVID and the talk of the vaccine and clinical trials in general seem very frequent in the news. So it's important that we're able to empower people to make decisions based on facts in this day and age right now. Of course, our effort is also aimed to increase referral to and enrollment of underrepresented patients in cancer-related clinical trials. And in turn, by doing both of those things, we hope to increase representation of currently underrepresented patients and better understand the relationship between sociodemographic factors and knowledge and intentions regarding clinical trials. I assume that most people are probably aware of, most people on this call are probably aware of various barriers and different mindsets that may exist related to clinical trials. I don't have a slide on this, but one of them may be just bringing up the historical mistreatment of racial and ethnic minorities in a research setting in the past. That may vary generationally, just depending on what people know, I guess, generationally related to that topic. But we're just trying to better understand what barriers may be for people participating in clinical trials as well. So this is a national issue, which I'm sure is also not new news for anybody on this call, but minority enrollment in oncology trials, clinical trials really, is very low. It's not representative of the nation's demographics, that's for sure. This is just a small table that I was able to pull from the FDA snapshot that was recently released, and this is data specific to 2019. They represent African American, Asian, and then for ethnicity, Hispanic or Latino. The data that were provided clearly are showing very low numbers for enrollment of those racial and ethnic groups. This is another slide that's perhaps more exciting or intriguing that represents data from 2008 until 2018. It's a number of trials. I think it's 230 different trials that were evaluated. And the graph or the chart on the right, which is labeled A, is just a percentage of patients enrolled in FDA drug approval trials by race and ethnicity, which seem to be sort of in line. I mean, it's definitely in line with the slide I just showed you previously, but that may be more in line with the US demographics. But what's more interesting to look at, probably not exciting, is graph B, which is a comparison of incidence and mortality with patients with cancer versus clinical trial enrollment. For white people, you see that incidence and mortality are pretty similar to the number enrolled. It's interesting to look at the Asian group with incidence and mortality being significantly less than enrollment. And then, of course, what's important to notice is for the Black and Hispanic groups, enrollment is definitely lower than what we're seeing for incidence and mortality rates. So that's kind of the introduction to the problem. That's, again, a national issue. And with our national outreach network that we're a part of, this is something that we're seeing from really all cancer sites, of course, and we're all trying to improve it. Getting a little more personal and closer to home, these are the data for clinical trial enrollment here at our cancer center. And this is actually pulled from a report that we submit as a grant every quarter. So this is just quarterly data, and this is recent as of September 30th. So these certainly could have changed since then. But specifically for minority participation in therapeutic or intervention clinical trials at our cancer center, you can see it's quite similar to the US data that I showed a couple slides ago. It's certainly not representative of our demographics in the state, specifically pointing out the Hispanic or Latino ethnic group of only being 4% represented there. It's a little bit better, but not by much, for the prevention and screening clinical trials at the Cancer Center. You can see a slight improvement for African American and Hispanic and Latino groups. But comparing those to our local demographics, Denver metro area, clearly in Denver metro and the state as a whole, we're seeing about 22 to 20% of the community members are Hispanic origin, and that's not what's represented in clinical trial enrollment on our campus. Again, I'm not calling out our campus, it's just a national issue. These are just the data that we have on our sites here, our trials here. So if we could just recruit some patients, that would be great. We definitely have a lot of room for improvement. And here are our planned methods for trying to do that. When we were originally awarded the grant from the National Outreach Network, our goal was to recruit English and Spanish speakers. We thought that we were, definitely in good hands there because Carlo and Jose both are Spanish speaking, which is definitely a huge help when trying to deliver a Spanish intervention. And we were also hoping to provide educational sessions in person. So the goal was to provide in-person groups of about 25 people, in-person educational sessions. We were going to automate everything. I guess not automate, but bring several iPads for people to fill out questionnaires at these groups. So there wasn't going to be really anything that folks would have to do outside of this 1 hour session. And hoping to host health fairs, be a part of health fairs. 9 News Health Fair was definitely one that we were signed up for. And then, of course, as we all know, the pandemic hit. So we had to rethink what community engagement looked like, which is definitely interesting, but we're getting there. So methods in the face of COVID, we still, of course, are still trying to recruit English and Spanish speakers. providing educational sessions are no longer going to happen in groups, in person, of course. They can happen in groups, but everything is virtual now. Our original goal was to recruit about 250 people. We didn't change that number by much because the access to connecting with people via Zoom makes us feel like we can still recruit that number of people. So we're hoping to recruit around 200. And all of the questionnaires are automated through REDCap still. It's just not on an iPad. It's just on someone's computers. So as soon as someone signs up for a session, everything is sort of triggered using a REDCap function that I didn't know existed before this study to automatically send a pre-questionnaire, and then 24 hours after they've attended this session, they get the post-questionnaire as well. And the questionnaire, again, is just to better understand how this education may influence or improve someone's attitudes and beliefs around clinical trials. So our educational materials were provided by the NCI. They were a PowerPoint provided by the NCI through the National Outreach Network. And we are given sort of free reign on these PowerPoints. We're able to modify them in any way that we feel is appropriate for the individuals that we may be trying to connect with. So I took a look at the English speaking one and tried to make any changes I saw necessary. Jose is the community health educator for the Spanish speaking presentation, which is the same content. And he was able to make any changes that he felt necessary to culturally tailor to Spanish speaking Coloradans. We've also been given info sheets, which were again also provided from the NCI. All of our materials were provided by them that are also in English and in Spanish. And then we have access to videos and any other content that we felt may be useful from the organization Stand Up to Cancer. They have a ton of great resources that are in English and Spanish, and I think they have other languages as well that provide a nice overview of clinical trials and some other topics that may be useful for someone wanting to know about prevention, control, anything really related to cancer. This is a slide example of one of the slides that we go over in the PowerPoint presentation with folks. And it's really about myths about clinical trials. So one of the myths that we talk about is study participants being given a placebo or a sugar pill instead of standard of care. So that was something that we review and assure people that placebos aren't used in place of standard treatment. Quality of care is not intentionally sacrificed in that way. Another myth that we review is study participation is for people without options. We, again, assure people that participation is for everyone. I recently did a session, and it was interesting to have a conversation with someone who really thought that it was sort of a last-ditch effort to participate in a clinical trial. And they were interested to find out, or I guess surprised to learn, that a prevention or screening trial could also be considered a clinical trial. So that it doesn't always mean that you're, taking a drug or doing a vaccination. Again, with the COVID vaccine, that's a very relevant topic for people right now. Another myth that we address is once people begin participation, they have to stay in the study. And I say this during my presentation to participants that as you're learning about clinical trials, this is a study, and you can feel free to sign off at any point. Luckily, no one has yet, but participation is voluntary, and participants can leave the study at any time, which was also a new topic for someone that I engaged with last week on this. They thought, the informed consent was sort of a binding document, which is interesting because that's part of the informed consent, is letting them know that it is voluntary. So it's been useful conversation so far with participants, and it's been a really useful slide, this one in particular, because it starts the conversation with participants or patients. Originally, I will say we did specify that it would only be cancer patients that could qualify for participating in this education. In terms of the questionnaire, anyone can listen into the presentation, but in terms of getting the questionnaire and then the compensation for participating in the questionnaire, we were trying to limit it just to cancer patients. But the more we talked with people, the more we understood that a lot of caregivers also have questions. People in general have a ton of questions about clinical trials. So we have actually submitted an amendment recently, I think in the last couple of months, to expand that so that we are able to present this content and collect questionnaire information from anybody who's interested. And so that was something that the NCI, the National Outreach Network specifically, is interested to hear more from us on our annual report for this grant about that and about why we made that decision. They felt like it was a really good move, but that was something that I was excited about to do through the amendment, just to expand it more to people. Here is our flyer, one of the flyers that we are able to provide to folks. It was very important to us that we had the exact same content that we do in English as was in Spanish as well. Sometimes this is not the case with Spanish material. I personally don't speak Spanish, so visually it looks the same to me, which is something that was important to me. But from what I've understood from people who are able to read and speak Spanish on our team, it's not the case that it includes all of the same information. A lot of the times, it just depends on the organization. Different resources are available to different organizations and they have different capacities to do this, but it was important to see that all of the topics that were provided in English were also covered in Spanish. So this is something that we would bring to a health fair. We had planned to bring to the 9 News health fairs. Obviously we were not able to, but it is something that we have still shared in different ways with our social media team at the Cancer Center, whether it's just pulling kind of like an excerpt of information, some statistics to share with people, whatever it may be. It's a valuable resource to be able to share with both campus and community partners. There have also been instances, just on the note of Spanish translation, Carlo and Jose have been able to translate some items for us. But again, that goes back to us wanting to add another team member who solely focuses on that, which is an exciting opportunity because it is time consuming and very much needed. This is a slide of just 4 questions. The questionnaire itself is very short. It is, I think, a total of 15 questions that sort of cover things like this. So the first 2 questions are just true or false. Once I sign a consent form, I must stay in the clinical trial until my doctor tells me I'm done. The other one is clinical trials test whether a new medicine or new treatment works. Those are both true or false questions. And then the last 2 are more of like a Likert scale of how likely someone is or is not to do something. I'm likely to talk to my family or friends about joining a clinical trial. That's an interesting one to look at to see what the responses are. And again, one of the aims that I hope to get out of this and that the study as a whole is focusing on is basically patient empowerment. And while there's not a tool specifically to measure that we're using or that I'm aware of, I think that question really gets at that, is how well are we able to prepare people to not only feel comfortable talking with their healthcare provider about clinical trials, but how well are they feeling that they are able to communicate with their friends and family members about clinical trials as well. And our outreach efforts, again, going back to the Dr. Evil air quote, what does community engagement look like? It looks very different than I think any of us thought when we first got this grant, but we are doing, I am biased, but I think we're doing a good job of getting creative and trying to connect with people in whatever way we can. The upside is that everyone's in the same boat. So we're all able to work together and communicate different strategies or different lessons learned that we may have throughout this process. Vuela for Health has been an awesome partner that we've connected with. And I use that term partner loosely. Of course, it's not a partnership that we've developed with the Cancer Center, but more of a collaboration in this effort. Vuela for Health is, I think, about 30 different promotoras who are all Spanish speaking, and their goal is to just provide health education for the Spanish speaking community members in the state. And they used to do pretty much, everything in person, and they have switched predominantly to virtual as well. And they've gotten really creative with using Facebook. So Jose actually did a Facebook Live interview with them recently about this project and just about some of the efforts that the Cancer Center as a whole, the community outreach and engagement as a whole are working on. There's different projects like I referred to earlier. The HPV vaccination education project is one. Just trying to better connect with the Spanish speaking community. The other one that we've connected to is cancer support groups across the state and nationally, but we have sort of invited ourselves or presented the opportunity for cancer groups to invite us to present about this opportunity to learn about clinical trials, whether that's just we pop in for a 5-minute spiel about this project that we're doing, or presenting the content itself fully in the group. Understanding, of course, that cancer support groups have very important agendas that they may need to tend to instead of this. But that's been a good way to connect with people who may be interested in this information. I actually had a session last week with a cancer support group that is meeting virtually, of course, and someone asked specifically about a clinical trial for lung cancer. And I was able to actually connect with Tiffany in the CCTO to not only provide contact information, but also connected to researchstudies.anschutz.edu, which has been a tremendous resource, and I anticipate will just become something that we use more and more as this study goes on. It's super user-friendly. If you haven't checked it out, I would highly recommend looking at it. It is, like I said, really user-friendly, and it's pretty easy to translate it into other languages from what I saw. English is the only language I know, unfortunately, so I'm not able to super attest to that, but it's a very useful website to understand what trials are going on our campus. Head and Neck Cancer Alliance is a nationwide, it's a national alliance for head and neck cancer patients, caregivers, survivors. And they are actually working on a clinical trials finder that's specific to head and neck cancer. I don't know specific details on what that clinical trials finder entails, but they have invited us to present in January, sort of in tandem with the release of this clinical trials finder, so that we are educating any member of this alliance, and then they have the opportunity to directly go find a clinical trial as well. Weld County Public Health Department, they have been awesome. One of the community educators with that public health department sort of befriended us about a year ago, and has been a really great contact, especially for that area of the state. Pre-COVID, we were able to attend a health fair at an elementary school, and of course aren't able to continue with those, but we've since kept in touch with that health department and connected with a Northeastern Colorado network, which is essentially just a team of people working in a healthcare setting, whether it's education, et cetera. And that's been really useful as well. Hablamos Hoy, I'm sorry for butchering that. If I did, again, I don't speak Spanish, but that is a radio segment that Jose has found. And they have invited him and then Dr. Barrio, our director, to come and do some educational interviews. They're, I think, 30-minute segments. So far they've done one, but the goal is to try to do them on a more consistent basis, just again, to provide education for communities that are not often reached when trying to provide clinical trials information. On campus, the UC Health navigators and social workers have been awesome to connect with as well. There are new patient packets depending on the clinic. I know every clinic operates slightly differently, But for the breast clinic, they have new patient packets, which we can provide clinical trials information. We can provide specific resources for signing up for this session. The social workers have also been really useful. The Cancer Center social media efforts have been another interesting avenue. The communications team with Jessica and Emma at the Cancer Center have been really useful in providing feedback for ways that we can post on social media. Of course, we do get everything COMERB approved. And one of the other suggestions that came out of working with them was, instead of having just an email address for people to email, instead having a sign up sheet, sort of like what you all use to sign up for this session. And that way we can kind of ask people questions that we normally would send in an email right away. And it makes it just more user friendly. And that's something that the COE as a whole is trying to improve. And then, of course, last but not least, the CCTO. They have been definitely very open to any suggestions we have. They've given us some good suggestions. Tiffany was really great in providing the contact information necessary, sort of on a whim when I needed it last week. And that's a very useful partnership to keep having. Challenges, of course, with any study, there's always challenges, but especially in a pandemic, we were able to change this format, obviously, to virtual, which was a very easy change for us to make, a very easy decision to make. There may just be a general lack of interest. I will admit it's been very difficult to get people to sign up for this educational session, whether they just aren't interested in the topic itself, or they have so much going on because we're in a pandemic and they just don't have time. But there could also be a lack of trust with the, information that's going on around COVID. And I think generally people are trying to be trusting of what guidelines are given out there. I think that there's still just this sort of lack of trust with so much unknown. And internet connectivity is something that has been mentioned by other groups, both on and off campus. We haven't experienced that yet, but I do anticipate, just with Colorado being such the mountainous state that it is, that will certainly be an issue that we could run into. Sort of a way around that is maybe doing something over the phone without a visual on the computer, but that's something that we haven't had to address just yet. And then, of course, language barriers. We do have Jose and Carlo on the team who are able to speak Spanish, but there are other languages that we don't have people that speak that language on our team that people will definitely benefit from having access to. And it is useful to have the education in Spanish, but I think just in general, the Spanish content is very limited around this topic. But optimism is a thing to hold on to get us through. And I could say that it's great timing for COVID because there is so much confusion regarding clinical trials just in general, but especially with the vaccine. And as more and more articles come out about the vaccine and the potential release of it, I think there's a lot of conversation that's happening and a lot of misinformation that's going on. So it's super important to me personally, and I know as a team, to provide factual information about clinical trials and how they're run, and help people have access to understanding what myths may be, and provide an opportunity to ask questions as well. Forcibly Zoomed. People are kind of forced into learning Zoom. I know I was talking earlier that my parents asked me to send them a Zoom link for Thanksgiving this year, and definitely something I didn't think that I'd ever hear them say, but people have figured out Zoom because they've had to. So although I do anticipate providing some sort of technical support at some point down the road, for the most part, people are pretty tech savvy right now when it comes to Zoom and doing a virtual education session. So that's been very useful. And then, of course, more reach. If we were doing all the sessions in person, there would be a lot of geographical barriers for people. Our plan was to drive around to the state and do different sessions in different areas of the state. But this way we're hopefully able to reach more people, because all people have to do is either call us or sign on to a Zoom link. And these are my references, and then I will stop sharing just because it's easier, I think, to ask questions when we can sort of all see faces. But I hope that this is useful for people. I hope that if anyone has questions or suggestions or anything, that we can have some productive conversation about it. It's definitely an important topic. Again, I'm biased, but I'm open to hearing any questions or feedback that you all may have.
Thank you, Sarah, so much. If you want to ask a question, you can either get off mute and ask, or you can put your question in the chat box. So please let us know if you have any questions on the presentation or their outreach efforts. So we have a question in the chat box from Lisa. What benchmarks are used to measure outcome success? So an example would be increase enrollment by X percentage, and is that set by the grant or locally?
So thank you for the question. We are reporting our clinical trial enrollment at our site. And yes, they haven't identified a specific percentage, but they just want to see basically what the clinical trial enrollment numbers were before we started these efforts, and then what they are when we finish them. Another thing that we report for the grant is our outreach efforts. So how many people we reach, how many people are just getting this education. So it is difficult because it's sort of but for the national group, for example, we may educate 400 people in that session, which would be great. But in terms of outcomes, we can't necessarily track specifically how that may have affected our clinical trials numbers. If someone indicates any interest in clinical trials after the session, we are tracking that and following up with them to see if they were able to get into a study. If they were not, we are tracking those, the reasons as why they weren't either eligible or they chose not to participate as well. I see another question about whether our team works with AHEC in any regions of Colorado. We do. Daniel Pacheco used to work with the Department of Family Medicine before he joined us. And that has been a connection that he was able to establish with us as well.
Any other questions? Well, again, thank you so much for joining. And as a reminder, please sign in using the link in the chat if you haven't already done so. An anonymous survey will be sent out after this for you to fill out, and we really encourage you do so we can get feedback on the presentation as well as any suggestions on future topics or speakers. Thank you again, Sarah, for presenting. This was a really great presentation, and I hope everyone has a great rest of your week.
Thank you.